Please welcome my guest, Dr. Hiroshi Andrews with Novant Health Gastroenterology, Brunswick. Thank you so much for joining us today. I'm so excited to have you.
Pleasure, June. Thanks for inviting me.
Yeah, you're quite welcome. Well, first of all, I know you're a very experienced gastroenterologist, but you're new to Novant Health.
That's right.
So what I love to do is introduce my new physicians to the community on this show, and just tell us a little bit about yourself. So let's start with your background.
Thank you.
You're welcome.
So I'm from the Northeast. I grew up in Vermont, and like a lot of Northerners, we found our hopefully last home here in coastal North Carolina. I was educated at Harvard with a degree in economics, actually, so I worked on Wall Street for a couple of years, but then found my true calling was medicine. So I did my medical school education in Philadelphia, where I met my wife, and we now have 4 children. And then I joined the Army on an Army scholarship, spent 11 years as a uniformed physician, some time in Korea and Afghanistan and in Georgia. And when we lived in Georgia, we had a nanny to help take care of our 3 kids in diapers at the time. And she told us about this wonderful place called Wilmington, which we'd never heard of. And we moved here after I got out of the Army. So we never looked back, yeah.
So how long have you been in practice?
I've been a board certified gastroenterologist now for 15 years. And so that was 4 years in the Army, 10 years in private practice in Wilmington, and a little over a year before coming to Novant.
So tell me a little bit about your practice, your partner, and where you're located.
So we're located here in Brunswick County, and we see our patients at the Gastroenterology office in Supply, and we do procedures at the Ambulatory Surgery Center there, as well as here at Brunswick Medical Center Hospital. Our practice is, we hope to be essentially a full-service digestive health or gastroenterology practice with care in liver disease as well. So specifically, folks who have chronic digestive problems, anything from irritable bowel to heartburn to friends and family members who suspect they have a gallbladder problem or celiac disease, that's wheat protein allergy. Something's just not right about their stomach. Someone who's always had a sensitive digestive tract. We hopefully can evaluate the individual and help them feel better and alleviate concerns they might have about their digestive complaints. Again, we also see patients with liver problems, anything from abnormal liver tests all the way to various serious chronic liver diseases. And then you mentioned our partner, Dr. Stuart Futch, is coming on board, and he's a very experienced gastroenterologist as well. We're excited to have him because he has a specialty in biliary disease and does a special procedure called ERCP for folks who might need that service here in Brunswick County. So essentially, we're hoping that your family doctors will be able to have confidence in referring you to us if needed, with the complete assurance that we can help diagnose and manage just about all of your digestive and liver concerns.
I think you also have 2 extenders. You have 2.
That's right. Our advanced practitioners, Shannon and Dottie, are outstanding. They are experienced, very caring, and they oftentimes will see the patient in the office before either I or Dr. Futch perform a endoscopic procedure, that is an upper endoscopy or a colonoscopy if that ends up being necessary.
Now, I know that both of you scope in the endoscopy center as well as here at the hospital. And I'm curious, how do you decide which facility is the best place for that to happen?
Good question. So primarily it's a decision based on an individual's medical history. So specifically if they're quite healthy and don't have any concerning medical problems, then they're an excellent candidate to have their procedure at the Ambulatory Surgery Center, which generally I think patients find is a better experience because it's smaller and not as intimidating, and you can pretty much get in and out quicker and get your hot breakfast sooner after your procedure. Here at the hospital, of course, we can take care of folks who do have more complicated health problems or medical conditions. We could say it's a safer environment for folks who need that.
And of course, if they're already an inpatient and need that procedure, they would be done here at the
Absolutely.
hospital.
You're right. I didn't mention that, but Dr. Futch and I will be taking care of folks who have any sort of digestive problem while they're hospitalized here at Brunswick Medical Center.
I know you went through a lengthy list of things that you diagnose and treat, but I wonder if there's anything of real clinical interest to you.
So the things that interest me actually are probably of the least interest to most gastroenterologists, which is, I would joke, job security for me. So specifically something called irritable bowel syndrome, which is very common, and some folks may have suffered from it their entire adult life and really not realize they have it. So that's something that is of interest to me. It's something that I focused my research on when I was in training as a gastroenterology fellow in the Army. It's something that typically affects women more than men, and women who are in the prime of their lives. So these are women who are in their 20s, 30s, and 40s, who have children perhaps, early careers, perhaps a spouse, and when they're affected, as they say, if mama's not happy, no one's happy, right?
Yes.
So we like to try to help these people get confidence that we can diagnose them if they have irritable bowel, and then treat them to help them, their quality of life and their entire life spheres also feel better.
That's really good information. In previous years, I know that people without any risk factors have been encouraged to have their first colonoscopy at 50. But recently, I think that has changed. Is that correct?
You're exactly right, June. So just as of the last 6 months, the United States Preventive Services Task Force, which is the primary arbiter of when we should get screening tests done, made a decision that it is advisable to have their first colonoscopy, that is, just like you said, average risk individuals to have their first colonoscopy starting at age 45. Now, if you're 48 or even 52 and you haven't had your colonoscopy, there's no need for alarm, but certainly individuals now who don't have any family members who have had colon cancer and are in good health are now candidates to have their first screening colonoscopy beginning at age 45, just like you said. That's correct.
Yeah. That's really good information, because we've all been going by the old adage, if you're 50, you need a colonoscopy, and now we need to rethink that and maybe start having those conversations sooner.
That's correct. So that's another thing to talk about when you see your family doctor.
Yeah, which we encourage everyone to have a primary care physician.
Absolutely.
Yeah. Are you taking new patients?
Yes, ma'am.
Oh, good.
Absolutely.
That's awesome. How about referrals? Do we need a referral from our primary care? Or
Typically,
can we call the office?
Good question. So typically a referral is required depending on the patient's insurance. We do accept self-referrals as well, so it depends.
It depends.
But yeah, please, if you do have your primary care provider, reach out to them, make an appointment, and then that's typically the best way to get an appointment with one of us at the gastroenterology office.
And if our viewers need any information about the practice, I'm sure they can just call the main number at the gastroenterology practice, and we'll be able to help them out.
That's right.
Great.
Or they can go to our website, and our contact information should be there too.
Wonderful. Well, thank you so much for coming today. I hope you'll come back soon after you've been here a while, and we'll talk about what's going on.
Thanks, June. Always a pleasure, and I look forward to seeing you again.
Thank you so much.